Welcome back. Dr. Jeffrey Jacob is with us right now from Harvard Eye Associates. Good to see you again,
morning,
as
Ken.
always.
Nice to see you as well.
And as I alluded to just a few minutes ago, we are going to talk about issues related to eyelids. And I know we've talked about this before, and we're talking about maybe eyelids that are beginning to droop or other problems as well, right?
Yeah. Lots of times people have issues with reading.
Yeah.
Being tired when they're not really, when they just woke up after a good night's sleep. And the most important one is when they're driving, not being able to see off to the side. So if you're driving and you're looking straight and there's some car off to your side and you can't see it because your lids are hanging down, that might be an issue. So,
yeah, I could see that.
Yeah. So fixing people's eyelids lots of times improves their quality of life and their safety.
Yeah.
And also their appearance as well.
What causes this? Is it just, as we age, everything begins to kind of droop a little bit. Is that really the cause, or there's other causes as well?
Yeah, that's probably the main cause. The sun causes the skin. There's little tiny fibers, like a rubber band in the skin called elastic fibers.
Yeah.
And just with sun exposure over the years, those little fibers, they stretch out.
Okay.
So the skin, rather than pulling back, it just remains stretched out. Kind of like a sock that you've had in your drawer for years, and you put it on and it falls down. Similar situation with the skin.
Okay, so what we're talking about here, obviously there is the aesthetic of it, how the person looks and feels, but there's real issues involved as well. And the issue is, of course, as you said, it can affect your sight and it can affect even your well-being.
Correct.
And how tired you may be, or just so many different things beyond the cosmetic part.
Correct.
Right?
Yeah, that's what we're talking about mostly. Your eye, the little black part in the middle.
Yeah.
It's called the pupil.
Right.
And it's just a little hole in the eye. You can't hold a pupil in your hand.
Yeah.
It's a hole in the colored part of the eye, and light goes through the pupil, and it hits the retina inside the eye, and that's how we see. And if the eyelid is drooping down and covering the aperture of the pupil, then it affects people's vision.
Yeah.
So it actually interferes with the vision. It makes things darker, and also cuts out the peripheral vision. So the improvement is manifest in that, improving that.
I didn't think about the peripheral vision, like you said.
Yeah.
So what can be done? Surgery, or
typically you have to have surgery to fix it. And sometimes we remove the skin, and actually sometimes there's a little muscle that opens the eyelid. And it's kind of like if you have in your garage that opens your garage door, there's an opener on the top of the door that pulls your garage up. Kind of the same thing. So there's a muscle that opens the eye.
Okay.
So sometimes from years of people who've worn contact lenses, they can get this. That's not uncommon. People who've had surgery can get this before, on their eyes. So what we do is everybody is different, and we tailor it to every individual. Not everybody gets the same surgery. We figure out what each person needs, but we can fix the muscle and or the skin.
Okay. Once this is done, what is the average recovery time, and is this something that will reoccur 3, 4, 5 years down the line?
If it reoccurs, it's going to probably be more like a couple of decades down the line.
Oh, really?
Because it takes that long for the skin to re-stretch out again.
Okay.
So, and the surgery, it's outpatient. Takes around an hour to fix it. And when the person is done, there's no patches on the eye. So as soon as surgery is done, you can see immediately.
Wow.
And there are stitches that we typically put in the eyelid that get taken out a week later.
Okay.
So the major effect that somebody will have after the surgery is they might be a little bruised and swollen for 2 weeks after the surgery. So if someone does it, I always say, make sure you don't have any weddings or trips to go on for 2 weeks after, because you might not look as good as you want to.
Okay, speaking of looks, we have certainly seen celebrities that have gotten some sort of eyelids type surgery, or more than likely for cosmetic reasons.
Right.
and they look like they're wide awake all the time or scared or whatever it might be.
Yeah, and that's what you're bringing up is probably the main reason why people are apprehensive about doing anything. And you know, if you've seen a Kenny Rogers or a Marie Osmond, they're a little overdone and they don't look like themselves. That's not what we are talking about at all today. You know, what we're talking about is improving somebody's vision and the way they can live and be more, feel more alert, but the goal is to make them look like themselves, just a better version of themselves. Not look like a different person.
Okay, what about, because there is a medical issue here rather than a cosmetic issue, is it covered by insurance?
Yeah, if we can show that it's interfering with somebody's vision, then it's considered medically necessary. And, the insurance, they have well-defined criteria that we have to meet in order for somebody to have this through insurance.
Okay, would someone have to have, in that case, vision insurance, or is this different?
No, this is considered a medical issue.
A medical issue.
This is not vision insurance at all. So this would go under your regular medical insurance.
Good.
Yeah, kind of like if you had a gallbladder that needed to be taken. Exactly that kind of insurance, because it's a medical issue and it's interfering with your vision and ability to function.
Okay. How would somebody find out that, besides just somebody looking at them and saying, hey, you know, your eyelids are drooping, or because it's done slowly over time, they may not notice it right away, that all of a sudden I'm not seeing as well as I used to.
Right. So the common things are they want to read, and after 10 minutes their eyes are closed and they feel like they have to go to sleep. That's a common thing that people have. Another common thing is they wake up in the morning and they're tired. Another common thing is people have headaches because you can use your forehead to raise your eyelids like this, and if you're doing that all day long, your forehead gets tired from contracting it to try to keep your eyes open. So those are the usual things. I mean, and then the other obvious one is just when someone has pictures taken of them and then they look at the photos, they look like they're sleeping. So, you know, sometimes people come in and that's what they talk about.
Why do people get tired? Is it because they're struggling?
They're struggling to keep their eyes open.
Okay.
You know, so if
you're working much harder at doing something that should be natural.
Right. So if you pull an all-nighter or you have to stay up for whatever reason and your eyes are trying to close and you're trying to do that gives you the tired feeling.
Okay. All right. Wow. I can see how this is beyond just cosmetic.
Yeah, it really makes it's a subtle thing, and we don't change anybody's appearance. They don't look different. They look just like them, but it really makes a nice difference. And the most common thing people say after is, I wish I would have done this a long time ago.
Yeah, definitely. So again, this is about an hour outpatient type situation.
And it's a local anesthetic. It's not general. You're not put out for it. There's no breathing tube, so the risks are minimalized for the surgery. So we just basically make people happy with a little IV medication and then do the surgery. So people are breathing by themselves, and then the recovery is easily too. So because when you're done with the surgery, people usually leave 15 minutes later.
That's great. So, now, over that course of the healing time, couple weeks, what you said, cold compresses, anything they do?
Yeah. So the first couple of days, cold compresses.
Do they need to sleep with?
No, not with the cold compresses, but they need to sleep with their head a little elevated. Because so gravity can help pull the swelling out of the eyelids.
All right, very good.
Yeah.
That's fantastic. And the fact that if you show that it is really causing a problem, it should be covered.
Yeah, and we try our best to, show that it's medically necessary, and most of the times it is.
All right. Now, of course, I guess if somebody just wants to come in to have it cosmetically done, you're fine with that too.
We can do that as well.
All right. So always good to see you.
You too.
Thank you very much.
I like your pre-Halloween bow tie.
Pre-Halloween. As I said to Jeffrey, that next week or so, once we get in October, I can put the pumpkin one on, but not until then. All right, Dr. Jeffrey Jacobs with Harvard Eye Associates. Always good to see you.
Likewise,
say hi to everyone over there for me.
Thank you,
we'll see someone from Harvard Eye again soon.
Good.
And we will be right back.